Good evening, everybody. Thank you for joining me again tonight on my bi-weekly, tri-weekly, whatever weekly you want to call it, mental health live stream. I try to log on at least 2 or 3 times a week to take questions and talk about mental illness and mental health and all that good stuff. Originally, I had tonight's live stream title mental health, but I want to really focus in on, you guys hear me talking a lot about when I say everyone has a degree of mental illness. I'm going to kind of get into that a little bit more tonight and talk about what is mental illness and conceptualizing it from, my work with 20 years. Again, my name's Dr. Stephen Walker. I'm a licensed psychologist. Thank you for tuning in live. Hi, Melissa, Samantha. How are you guys doing? Thanks for tuning in. We're going to talk tonight. And again, if you're catching this live for the first time or after I upload it, these mental health live streams are for you to engage with me about your mental illness. Now, why do I say mental illness? Hey, Kat, how are you? Welcome back. Because we all have a degree of mental illness. We all have a degree of physical illness. Some people have acid reflux. Some people have migraine. Some people have pain in their knees, kidney, whatever it may be. We all have a degree of physical illness to a degree, and then we all have a degree of mental illness. So let's talk a little bit about what mental illness is, what mental illness isn't, and how to work on that, okay? Because Melissa's saying struggling with the world anxiety. Absolutely, absolutely. Hey, Joanna, how are you? Borderline personality disorder and relationships. Absolutely. Again, Joanna, I don't know if you're talking about yourself or just in general, but when we look at mental illness, okay, we have to look at mental illness as something that we all have. We have to look at conceptualizing mental illness away from extreme forms of mental illness into more normalized forms of mental illness. Because the reason I make that distinction or help people look at that is so that people will accept the fact that it's okay if you have a degree of mental illness. It's okay if you have something in you that is causing you pain. So if to break it down into that, mental illness is anything that causes you pain mentally, psychologically, or emotionally, is causing your relationships pain, is causing other people to have pain. Okay, that's what I mean when I say everyone has a degree of mental illness. So Kat is saying I could be better, but I won't get into that here. I don't want to trigger anyone. No, Kat, I mean, this is where you talk about it. This is why I do these live streams. So people will talk about their mental illness and talk about whatever's going on. Kat's been very open about some of the issues she has from trauma that has caused her psyche to split off into different personalities, and she's been very open about it. Why is Kat open about it? Because there's no reason to be ashamed of it. She didn't ask for the trauma that caused the mental illness. Hi, Candace, how are you? You've been helping with mine for years. Thank you, Candace. So appreciate your help and direction. No problem. Candace has been on before talking about some of her sexual abuse and how she's on the process of recovering from that and has nothing to be ashamed about with that. Hey, Juan, how are you? I was never scared of heights until my father told me he was. Think of that. I'm trying to understand if there's a connection and how it works, if there's a label for this. Well, it's conditioning, Juan. If you never had any fear of heights until how old were you when you developed that fear of heights? That would be something I'd be curious about. Did your father scare you? Did he hold you towards the edge? A lot of what all of us struggle with when it comes to mental illness, myself included, is we have shame associated with that. Juan was 9 when that happened. So yeah, Juan. So imagine that, people. So Juan never had a fear of mental heights. Some mental heights, lovely. Was never scared of heights until his father told him he had a fear of heights. So Juan, he projected that into his son, and now his son developed a fear of heights. Guys, this is why I'm doing these live streams, so that we can all engage with something we all have. So let's take Juan's example of mental illness. So Juan would have to look at that from the degree of what kind of pain is it causing me? What kind of dysfunction is it causing me on a clinical level? most disorders, they rise to a disorder level when you have clinically significant impairment or distress. But that's a very subjective term. It's a very vague term if you think about it, because one person's clinically significant impairment or distress may not be another person's clinically significant impairment or distress. Mental illness is just like physical illness, meaning that some people have severe physical illness, some people have mild physical illness. Everyone has a degree of mental illness. The issue is we don't talk about it. We don't talk about that. So Kat's saying, I relapsed and I don't name, I got out and self-harm for the first time in 3 years. Well, Kat, let's talk about that a little bit. What triggered that? What was going on around you that made that alter ego or alter personality come out, and then you needed to self-harm? What did that self-harm do for you to compensate for what you were feeling? The main thing I would tell you right now, Kat, is you've got to forgive Kat. You got to take it easy on Kat and say, it's okay that this happened. This is the first time in 3 years, and I'm going to get back on track. I'm going to find a way to get myself back into an equilibrium, whatever you and your psychologist, your mental health person are working on, and bring that into you so that you can not start with the process of beating up Kat. Remember, Kat, you are a victim of trauma. You have been traumatized, which is why your psyche has fragmented out the way it has. You've got to look at it almost like, you're an addict and you relapse. Now it's time to say, okay, look, it's okay that I relapse. Why did I relapse? And it's time for me to get back on the horse and start working on it again. Kat, you've got to keep working on your relationship with Kat. If Kat slips into, and I know it's not easy, especially when you have a significant mental illness, to hate yourself and hate the mental illness and hate, I don't know how bad you self-harmed, but again, this is the process of healing. You're going to fall off. And remember, to learn how to ride a horse, you got to fall off the horse. So what I would say to Kat is, Kat's got to say to herself, it's okay. It's okay that this happened. This is a lot of this is out of your control. And I have to just accept that I'm gonna get back on the horse and look at it from the perspective. Don't look at it from the perspective, Kat, that, oh, my 3 years are gone. There are parts of the AA model I'm really not crazy about. One of them is this idea that you could be sober for 3 or 4 years and you slip up and then all your 3 or 4 years of work is gone. I'm not really crazy about that. What I would say to you, Kat, is those 3 years that you had without this happening, you've got to focus on that. Think about it in terms of a scale, Kat. Which one weighs more, 3 years or the amount of time you've been dealing with this relapse? You got to look at it like, which is stronger? Hating yourself at this point or hating your mental illness, Kat, is only going to make all of the altars get fired up again. Okay? So I would recommend talk yourself down. Say to yourself, it's okay that this happened. Okay, I'll wait for a comment from you and then we'll keep going. Juan is saying, let's see here. Juan is saying, he never did anything negative to me to fear heights. Okay, great. Does it have to do with my identity or connection or empathy towards my pops? I don't know. It could. It could be modeling. It could be, I see it in my 5-year-old Juan. It could be that, at 9 years old, you were very impressionable. Maybe you thought, I want to be like dad. It could be. But what I would ask you, Juan, is what are you doing now to work on it? It sounds to me like you're not crazy about having this fear of heights. And what I mean by crazy about having it is there, as I've talked about in some previous live streams, there are terms in psychology called ego dystonic and ego systonic. Ego dystonic is, I have something in my mind, there's something affecting me and it drives me crazy. I hate that I'm like this. That's ego dystonic. Ego systonic is, there's something in my mind that's affecting me and I'm okay with it. So what I mean is, maybe you're okay with having a fear of heights. You avoid cliffs, you avoid planes, you avoid bridges, and you're okay with it. But if you're not, then I would suggest you work on it. How do you work on it, Juan? You do a form of exposure therapy with a professional, with somebody who knows what they're doing, who can slowly expose you to your fear of heights, get into where you learned it, go back to that period of time where you were with your dad, expose yourself to some of that by talking things out, and then working you through a series of exercises where you can eventually be exposed to heights and manage the anxiety associated with it. One of the things I would suggest to you, Juan, is you could do a form of visualization. I don't recommend you go to a bridge or a cliff on your own until you've done a lot of this, but you can start visualizing yourself standing on a bridge, on a cliff, and feel that anxiety coming up. Visualization is a very, very powerful tool that helps you expose your mind to things prior to exposing it, being exposed to it. That's why athletes do a lot of visualization. They'll visualize themselves scoring a touchdown, hitting a home run, whatever it may be. So I would recommend to you, Juan, is you first have to make it okay that you have a fear of heights, brother. You have to say to yourself, it's okay. It's okay that I have this fear of heights. And now, again, like I was saying to Kat and everyone else, I didn't ask for it. I didn't ask for this conditioning, but it's okay that I have this fear of heights. So I am going to work on it. There's nothing to be ashamed of. I didn't ask for it. I don't even really want it, but I got to work on it. And Juan, I guarantee you, brother, your phobia to heights can be worked on, bro. I mean, that's, I'm not saying that like I'm selling you snake oil. I'm just telling you that exposure therapy is you can type that into Google and look at the efficacy rates, the effectiveness of it. Cognitive behavioral therapy using exposure therapy and using psychodynamic therapy all blended into each other, which again takes somebody who knows what they're doing to help you do that. You can absolutely work on that fear of heights, bro. But you've got to say to yourself, it's okay that I have it and I got to work on it. Okay. So getting back to Kat, I've tried to explain to myself, AKA her, that they're no long-term recovery with what is temporary release of pain, but does it make it go away permanently? It doesn't make it go away permanently. Yeah, Kat, because, I think on a conceptualization, a case conceptualization level, the trauma that's still causing the need for the alters needs to be gotten to, so to speak. Yeah, I know that's very professional, but you know what I mean. You've got to keep doing that trauma work associated with whatever's causing these alters to need to exist. Now, that being said, it sounds like you're doing some good work and you've got a good relationship with your psychologist. So what I would recommend to you is to keep working on Kat's relationship with Kat. Okay. The pain is a temporary release, but it is just a temporary release. It's not going to solve the problem. What I would ask you, Kat, is what does the pain do for you? How does the pain help you? So I'll wait to hear from you on that. And let me just back up here and see if anyone else has asked some questions. Let's see. But again, thank you everybody for logging on and commiserating with each other and empathizing with each other, because that's the whole reason that I'm doing this. Because we as a culture, I see so much rampant unworked on mental illness on the internet. People are ingesting this information, not only from mental health people from podcasters with millions of followers, are just feeding them all these extreme forms of thinking and looking at life from this one-sided view that everything's, if you look at things politically, that everything's about to collapse. We're headed towards socialism. The libtards are now in charge. And then when the Republicans were in charge, it was the other way around, with the liberals saying that the conservatives are going to take the none of these extreme things. Well, granted, a pretty extreme thing happened in the Capitol the other day. That was scary. But we've got to look at, okay, that spiked up at the Capitol and now we're back on the way down. And what are people beginning to understand? That is an inappropriate way of showing that you're unhappy with either an election or the direction of the country. I'll tell you what, I would not want to be one of those people who stormed the Capitol and whose faces, they caught video of it, because those people are going to jail. Those people are going to spend a lot of time in jail, all because their mental illness that they're not aware of, that is telling them, oh, the country is where the election has been stolen, and I'm not mocking them. I'm just saying that degree of mental illness, that polarized way of thinking, is driving their behavior, and they're not even aware enough. They're not even sitting back saying to themselves, well, wait a minute. I mean, is it possible that maybe this country's not going to turn socialist? Is it possible that everything I'm afraid of is being fed into me to a point where I'm not even aware that that's how I'm thinking? That's what mental illness does. And that can be for suspicions about your spouse. That could be paranoia about your coworkers. That could be compulsive shopping. That could be compulsive eating. That could be any form of mental illness. That is what mental illness is. That is why I say everyone has a degree of mental illness. People are so caught in their conditioning. They're so caught in the way they think that they're not even aware of how extreme their thinking is. And that's what mental illness is, an extreme form of thinking that's causing you pain or causing people around you pain. So let me just get back to some comments here. Kat is saying, personally, it doesn't help me or help her. I'd rather she do it. The other, I have to deal with the wound care. I'm being admitted to psych ward after she gets her release. Yeah, Kat, you gotta, these issues are not going to go away easily, and you've got to, I don't know if you've even thought about perhaps, another stint of time of being in some kind of acute care facility so that you can get the kind of help you need in a place where you can manage it. And I know I'm not saying that's the only option, but if you feel that things are coming a little, unglued, so to speak, you got to access the care again, just like if you were physically ill and you had, oh my God, I have blood in my stool, or I've got massive pain, or my skin, or whatever. You got to look at it that way. So I know that this is difficult for you, sister, and we all feel for you because you're dealing with a lot. You've got, a severe case of mental illness, but you're working on it. You're treating it. And I know that that's not always the easiest thing to hear somebody say, that they're empathizing with you, but we do. Sister, I've worked in psychiatric units. I've worked in prisons. I've worked in multiple clinical settings, and I've seen people struggling with all forms of psychiatric illness. But you're functioning, Kat. I don't know, again, if you work. I don't know if if you're married, or if you live with your parents, or if you live alone. But you're functioning. You're trying to get the alters, the alter egos, the alter personalities to all kind of live together, but they're not. I know they're competing for prominence. They're competing for being in charge. Some are, some aren't. So I do feel for you. Okay, so stay on with us. I'll come back to you in a second. Let me go back to, let me see here. Candace is saying, visualizing things helped me get through a very tough conversation and get through things I never thought I would get in the past. Absolutely. Let me see here. Melissa saying, I have PTSD, 20 years of abuse from 2 male abusers. Yeah, Melissa, and it's good that you're talking about that more. You're integrating it. You're thinking about it. You're trying to get yourself into a place where you can work on it, where you can say to yourself, look, I didn't ask for this post-traumatic stress disorder. I didn't ask to be abused, but I've got to work on that. And Melissa, we've talked a little bit about either coming on the show or exchanging some messages, but part of what you're going through is a process, I think, of just getting accustomed or getting used to the idea that I've got some issues that I need to work on. This is why I'm doing these live streams, so people can normalize and say to themselves, look, I'm not the only one that's been abused. I'm not, you know, I'm not. So the 20 years of abuse needs to be worked on. Now, from your perspective, Melissa, as we talked a few times on some of the previous live streams, it must seem like, oh my God, I don't even want to go near that. I don't even want to begin to deal with that because it's going to overwhelm me. Usually that's not how it works. The fear of working on it is making a lot of what you're feeling worse. Excuse me. One of the things I encourage everyone to do is, if they have a degree of mental illness, is accepting it and working on it, because it's not going to heal itself. You've got to work on it to heal it. As you've heard me say before, you have to feel it in a therapeutic way to heal it. You can't just expose yourself to it unless somebody is there to help you through that. So Candace is saying that was discussed in the Capitol riots. Absolutely. Absolutely. The internet is so full of all kinds of information. People just don't know how to filter it all. Hey, Fernando, how you doing? Absolutely. Because a lot of people don't even question, the source of who they're listening to. I mean, these people who have all these followers and all these, it's like no one stops and goes, what's up with this dude? Like, why am I listening to this guy? What kind of training do they have? Have they served in politics? Have they actually tried to help society? Like I know a lot of politicians are more self-serving, but I mean, if you're going to put yourself up as an expert in a field, then you should have some training or experience in it. At least, I mean, if I'm watching a home improvement guy on the internet, and then I find out he rents an apartment and lives with his parents or has never owned a home, I mean, hello. But we need to question the source of this information, okay? Melissa is saying, I have panic attacks that were very violent as the years have progressed, and I've worked very hard to gain awareness as they are happening. Beautiful. Awareness is the key. I would say go deeper, not only awareness as they're happening, but awareness as to what is causing them to happen, meaning what is happening when I'm feeling the panic. A lot of times when you're feeling that anxiety, it could be a flashback, it could be something triggered it, but that is where the work is, because what you'll find, Melissa, is when you're doing this work with somebody is the person can help trigger that panic attack in a session so that you can be slowly exposed to it so that you can learn how to manage it. Like the last show we did on panic attacks, that's exactly part of how you work on a panic attack, is you slowly expose yourself to it so that you can learn to work on it. That's why when the topic of the show, how to work on your mental illness, is because you've got to accept, and I'm not talking about just you, Melissa, but we all have to accept whatever degree of mental illness we have, make it okay, and work on it. There's no other way around it. Denial, the old joke, denial is not just a river in Egypt, but denial is one of the things that keeps mental illness locked in. Think about it in terms of physical illness. If I have a physical illness, like I got this blood blister on my hand, one of the few times I tried some home improvement, not doing that again. But anyway, let's say all of a sudden it starts spreading out and my hand starts turning green or whatever. And I'm like, nothing. Next day it's purple. Next day, can't feel my hand, and I just keep denying that it's ill. What's going to happen to my hand? So that's what people do with their mental illness. They deny their mental illness. They deny that they have issues. They deny that something's wrong with them. Why? Because society tells them, kill the pain, don't show weakness, you should be over it, let it go, and all this other garbage that you see from other self-helpers on the internet telling you, oh, just live your best self and don't focus on the negative and all that, which is complete crap. I'm not saying that's not part of getting well, but that is a component of that. Telling somebody, like I posted on Twitter about, they just had this study about how to cure phobias by I don't know, Wall Street Journal or whatever. And I posted saying something that, that depends on the degree of trauma that the person has experienced that is helping to keep that phobia in place. You can't just think that every phobia or every fear or everything that's can be treated the exact same way. That's like saying, well, this cancer treatment will work with this cancer patient. Oh, wait a minute, they have a different degree they have a different type of cancer. Oh no, well, we're going to just impose the same. It doesn't work that way. The reason we've got these proliferation of these self-helpers is because there's no regulation. There's no agency saying, well, wait a second, how the hell are you in a position to help people with their mental illness? Do you have any training? So mental illness is one of the most undertreated illnesses in our culture. Why? Because people don't want to admit that they have a degree of mental illness. They don't. They want to just brush it under the rug and say, I'm fine, and I'm going to just focus on the positive, and I'm going to deny. I have people in my own family that don't want to deal with their mental illness, and things just get progressively worse, and they self-medicate and lie to themselves and tell themselves they're a guru or whatever, and then they never work on it. They never deal with the trauma from their past. They don't even want to talk about it. You got to talk about it. You got to work on it, and you got to deal with it. That's the way it heals. Okay. So Melissa, you got to get into a situation where you can start working on what's causing the panic attacks. Okay. Melissa's saying as the years progress, they have simplified. Okay. That's good to hear. I'm glad to hear that things are abating to a degree. Let's see. Candace is saying this yeah, okay, I'm finally getting better in managing it. Beautiful. It must be addressed, Cap. Keep working on it, is Samantha saying. PTSD, depression, addict at 15, now 56 and clean. Beautiful, Samantha. How did you get there, by the way? How did you get to get clean? How many years have you been clean? I've worked through maternal trauma. I hate to, so I could be a good mom. I had to, sorry, so I could be a good mom. Excellent. Candace is saying, preach it, coach. I hear you. Melissa's saying, but I have some serious issues with men. Well, of course you do. If men, those two men physically and sexually abuse you for 20 years, of course you're going to think all men are like that. Of course you're going to think that men can't be trusted, and that it's going to happen again, and there's no hope in believing that. But that's the trauma talking. That's the infection. Remember, if this is infected, it's not, it's just the outside skin. That would be making my whole hand feel numb. That's the illness associated with that cut. You got these cuts in you, Melissa, that you got to work on. Okay, you got to work on that. Penny, hey, Penny. Yes, we're being polarized by all the media platforms. Absolutely. Absolutely. But that doesn't mean we have to be polarized. Okay, we don't. We can allow ourselves to have balanced political, mental, psychological, physical, whatever, balanced perspectives on things in general. We can allow. I've started a kind of a side project called demopublicans.org. Demopublicans is the idea that I have views about being a Democrat, and I have views on being a Republican. I allow myself both of those. And that helps me balance out I lean more liberal, of course. I'm a helper. I like helping people. I believe we should be helping people, but I don't like creating dependency. I don't think we should be creating dependency in people. So yeah, you're right, Penny. We need to question how polarized we allow ourselves to be. Okay. Let me see here. Go back up a little bit here. Melissa saying, what would you say is a good way to manage damage caused by narcissistic abuse? Hey, Mkella from YouTube, how are you? I'll get to your question in a second. Thank you for your questions. Let's see here. How would I say is a good way to manage damage caused by narcissistic abuse? Well, again, Melissa, you know what I'm going to say. You got to get yourself into a situation where you can work on that. You got to get yourself into a situation where you can work on the narcissistic abuse. And narcissism is really the hot topic these days. But you've got to identify how that narcissistic abuse is still affecting you. Because what I've heard in a lot of your comments, Melissa, is that you're aware of a lot of what is affecting you, but you haven't had a systematic approach to healing it. So one of the best ways to manage damage caused by narcissistic abuse, if you're not going to work on it, is continuing to be aware that you have been damaged by narcissistic abuse. And I need to be aware of that as I try to relate to men or other people in my life in relationships. Because And Melissa, the from what you've posted and what you've talked about frequently on these live streams, it's very hard for me not to keep pushing you to get professional help, because let's say I was an oncologist and this was my cancer treatment live stream, and you logged on and you're telling me about some of your symptoms of cancer, and then you ask me, well, doc, what's the best way to treat metastatic breast cancer? My first question would be to you, are you getting treatment for it? Are you getting chemo? Who's your oncologist? Who are you working with? It's the same thing with psychology, guys. I know psychology is this soft science and all that, what they say, but the reality of it is there's incontrovertible data coming out. Incontrovertible? Yeah, well, it sounded right. But anyway, data suggesting that there is science now associated with the treatment of mental illness. There is repeatable results that you can have, but it takes work. So Melissa, you got to start working on that, sister. You got to get yourself into a place where you're accessing either your mental health benefits, your health insurance benefits, so that you can start working on it. But the damage caused by narcissistic abuse is still affecting you. And that needs to go into remission. It needs to be healed, and it needs a systematic approach to working on it in a way that you can start working on that trauma. But if you're not going to work on it, in a structured way, my coaching to you at this point, when you're in a relationship with somebody, you've got to be conscious of how the trauma is affecting your perception of the relationship and the person. Because if you've been abused by a narcissist, you're going to assume that everyone's a narcissist. You're going to have a lens, like, if I had green tint on these lenses, that I would look at around, oh, wow, the whole world's green. That's what trauma does. It taints, it causes, it filters information through into our brain. And there's you see, and even little things, little behaviors are now magnified into, see, that person's a narcissist. Okay, so you got to get yourself into a situation where you can work on it, Melissa. You can do this. You can find somebody online, or you can, I don't know where you live, but you can access it. Psychology Today Therapist Finder has a great resource. Just go into Google, Psychology Today Therapist Finder, and see if somebody in your area can work on it. So, the damage caused by narcissistic abuse can be healed. Okay. So I would like to know about this too, Melissa. Good. Melissa, make a list of everything he said about you, read it back to yourself, but realize everything he said really applies to himself. Good, not you. Then burn the list, and all his words at the same time won't fix it all, but it will help to a degree. Yes, that's a good exercise. Mkella is saying, hey, can you please help me get in contact with a good counselor? Sure, Mkella, I don't know where you are in the world, but if you're in the United States, like I just said, type into Google, Psychology Today Therapist Finder. You can find, I don't know if you have health insurance benefits or whatever, but usually because of COVID, a lot of the health insurance companies have really relaxed their rules for telepsychology. And I really hope that's the beginning of the field moving into this, because it's very powerful. You think it's not. You're watching me now and you're feeling me and you're listening. It's the same thing if you're engaging and going back and forth with somebody. So let me see. Let me look down. Mkella. I'm in PA, but I'm willing to do Zoom. Yeah, Mkella, go on to Psychology Today Therapist Finder, or go on to Google and type in counselor in my area or whatever. And I don't know if you have health benefits or whatever, but you can usually access those benefits. Not much what's good in PA. I don't, I hear you, Juan. Hey, I went to Penn State, so I like Pennsylvania, man. But you can generally find, cold as hell, I bet. Mkella, is this live? Yeah, it sure is live, my brother or sister. How does he see the questions? They pop up live on a stream right over here. You can't see it as they come up. Bro, the cold is my element. Juan is saying, call me snowman. Cool. Yeah, I hear you on that, Juan. Let me see. Let's see. Okay. Yeah. Mkella, you gotta find, if you're looking, it's great that you're taking that step. So what do we hear? Mkilla. Oh, Mkilla. Oh, I got you. Mkilla. I'm sorry. I read that wrong. You're a killer, huh? No, I feel you. But it's good that you're identifying you need to work on something, bro. It's good. There's nothing wrong with it. If you had a toothache, you'd be finding a dentist. If you got a mental ache, a pain in your head, if you got pain from past crap that's happened to you, work on it. Men need to work on their issues. Men almost more than women, because we're the ones who say, no, nothing's wrong with me. I'm perfect. And then we bleed all over people and have anger and beat people up and hurt people, all because we're not working on our issues. So Mkilla, you can work on that, whatever's affecting you, my brother. You can send me a message too, and we can chat a little bit if that helps. I don't know where in PA you are, but I actually went to Penn State and outside of Pittsburgh, and then went to State College. And I lived in State College as a kid. My father taught at Penn State. So can you talk a little bit about your balding? That's funny. Funny you should say that, because you're new here. I've talked extensively about how losing my hair in my 20s affected me. So I've integrated it into me now, and I wish I just have beautiful curly hair. And so, but yeah, it's funny you say that, but balding affects people's self-image. It affects people's self-esteem. We live in a culture where people expect a bald, full head of hair means virility and confidence, and men struggle with that too. I have a former friend who has a pretty extensive live stream that he does on men losing their hair, RN, and it's affecting me. Okay, well, cool. Yeah, talk about it with somebody, bro. My email, let me see here. I need to make a thing on that, but here's my website, man. Let me see here. Where is this thing? I don't know. Okay, here it is. This is my website, so you can contact me through here. And send me a message, and feel free to do that. But that's good. Mkilla is saying that, look, he's 23, he's losing his hair, and it's bumming him out. And that's the first step, is saying, look, this is what's causing me pain. The pain is making me feel bad about myself, and I got to work on that. And you got to work on it, brother, because what I learned when I started losing my hair in my early 20s, you're right around your age, was I had friends that would call me, Stevie Hair Weavy and Chrome Dome and dude, Chia Head and all these great things men do to each other. But that I was putting a lot of my self-confidence in protein, little strands of protein coming out of my head, and that affected me. Okay. What state am I in? My office is in Florida. I'm currently in Colorado, but I'm going to be going back and forth to Florida occasionally as the COVID restrictions are flying. I don't want to fly, but right now I'm in Colorado, but my business is located out of Florida. So I'm licensed in Florida. So let's see. Let's go back up here a little bit, see what else is going on with people. Nice, Sam. Sam is saying stop meth 34 years ago. Way to go, Samantha. Cold turkey. Stop drinking 18 years ago. Damn, girl, you go. That's awesome. Cold turkey. Stop cigarettes 9 years ago. Wow. E-cigs lowering nicotine over months, weaning down. Great. Then got to 0 mg of nicotine and quit. Outstanding, sister. That's beautiful. That's this. Samantha, I don't know how old you are, but get some training in mental health and go help some people, because you got a lot of life experience there that could help people. How you did that and how you stuck to it. So hats off to you. Cold turkey ain't easy when it comes to meth. My Lord, I can't tell you how many people I've worked with in detoxes, detoxing off all kinds of things. Meth is not pretty. Meth actually, as you probably know, puts holes in your frontal lobe. So what I would recommend to you, Samantha, is to, share that knowledge. I don't know if you're in support groups. I'm sure you're in probably some, I don't know if you're in any of the AA or NAs. So, but that's a beautiful thing that you've been able to do that. So let me just go back to what this live stream was about tonight, which is how to work on your mental illness. The first step in the process of working on your mental illness, I bet it was hell. I bet it was hell. And then Samantha, what was how do you stay clean now? Like what motivates you? Because part of addiction work or addiction recovery is motivation, getting yourself on a daily level motivated. So what motivates you, Samantha, to stay clean? I'd love to hear about that. So how do we begin working on our mental illness, guys? Accepting that I have a degree of mental illness, accepting it, saying that it's okay that I have this mental illness. It's okay that this is affecting me, but I got to work on it. And Killa is talking about how his self-esteem has been affected by his, you're welcome, Samantha, is talking about his self-esteem and confidence being affected by his hair loss. That is not something to minimize. Men are, I don't want to say as affected by body image as women, but definitely as affected. So I'll say it, as affected by body image issues as women are. It's great, Samantha. So Samantha's saying a lot of her motivation, a lot of her source of strength comes from God, love of self. Absolutely. That's great. Samantha, did you like what was fueling the addiction? Did you get into that? Like, have you thought like that's, if you were doing meth, that's a pretty significant drug. So what I'm guessing is there may have been some trauma in your past, and I'm just curious if you worked on that. So getting back to the topic of how to work on your mental illness, after you begin to accept it and say it's okay that I have a degree of mental illness, then the process becomes saying to yourself, I need to work on it. I need to find it. Now, not all mental illness requires working with a counselor or psychologist or whatever. I'm not saying everybody with mental illness needs to work on that, but you have to determine to what degree of trauma or what mental illness I have, how deep is it within me? Is it something that could be solved with some self-help books, hopefully written by people in the mental health field, hopefully people who have training in the mental health field? But you have to determine how deep is this mental illness in me and what can I actually do about it, okay? Let me see here. Killa, I keep some info private, but I looked something up on, don't quote me, but here's a number. Well, I don't know what number this is, man. This is Juan. Juan's helping out Killa. Okay, cool. I don't know if you can see that, Juan, because I don't know if these messages are relayed back and forth from YouTube. I've got a streaming platform that streams live to Twitter, Facebook, and YouTube. So I don't know if Killa can see that, and I don't know what that number is, but you know, Juan, since you've been a frequent viewer, I'm going to leave that up. I usually don't let people post things like that, but that's cool. I know you're trying to help Killa. So, yeah, mental illness. The thing about mental illness is this. Once you accept that you have a degree of mental illness, then the process gets easier and easier for you to work on that. Because once you're out of denial, once you're out of that, and then you can move into a process of seeking out help for that. Okay. So Samantha's saying my mother's answer to stuff was a Valium and a glass of wine. So modeling, there you go. Starting at 11. So I would not fight with my father. So wait a second. You're saying that at 11, your mother was giving you Valium and a glass of wine, or you at 11 saw your mom taking Valium and a glass of wine? So, but if you're saying to me, oh, Juan is saying crisis hotline. Thanks, man. If you're saying that your mom was giving you Valium and wine at the age of 11, you know, that's some pretty significant child abuse there. So what I'm wondering is so I'll wait to hear before I go off here. So Samantha, can you let me know, are you saying, so you're saying, yes, your mom was giving you wine and Valium at 11. So if that was happening and that was the boundary situations in your family, I can just imagine what little Samantha must have been going through. Okay. I can just imagine what other abuse. So I can see where, as this was happening around you, the drug abuse, the alcohol must have kept going and going and going. Samantha, did you ever get any help? Did you ever work with somebody in the mental health field? Did you ever get any kind of structured treatment? I'd be curious to see, how you got yourself to this position of sobriety, which is incredible that you've been able to heal a lot of this. So I'll wait to see what you're saying. But Mkilla, I don't know. I was diagnosed with addiction and alcoholism at 15. Exactly. Wow. I tell you, man, some of the crap parents do to kids is just, I don't know what kind of relationship you have with your mom, but I would imagine. But Samantha, if you ever want to come on and talk about some of this and let people hear your story, oh, good. Yes, many years. Beautiful. If you ever want to come on and talk about this openly and let people get inspired by your story like Candace did and a few other people have, let me know, shoot me a message, and we'll do a pre-interview and just kind of keep some parameters on it. But yes, Samantha, that's great. And it's great to hear that you got treatment for it, because I think you and I both know, had you not gotten treatment, who knows if Samantha would even be here right now, because that level of abuse and that level of trauma, oh, your mom's passed away. Sorry to hear that. If that level of trauma and abuse must have been very difficult growing up as a teenager. And I don't know if you have any siblings, if you guys ever talk about it. But so, all right, well, listen, it's Friday night. I am going to probably log off here in a few minutes. But again, please remember, these mental health live streams are for you. Please share this. Please tell people about it. I'm going to continue doing these as long as people log on live and engage with me and do some other things. I'm going to be expanding some content in a little while. I'm going to be doing some other things, but I want everyone. No problem, Mkilla. You're welcome. Thanks for your time. Thanks for logging in. But seriously, Mkilla, when it comes to whatever you're struggling with, bro, and whatever, and I'm assuming you're a guy, but whatever you're struggling with, you've got to say to yourself tonight, look in the mirror, and you got to start treating yourself better. You got to say to yourself, look, it's okay that I got these issues. I'm going to work on it. It's okay, but I got to work on it. Okay. Don't keep hating yourself specifically for losing your hair. That is something you can integrate into you, bro. Trust me. Okay. So good. Seek out the help, log back on. Let me know, shoot me a message. Let me know how things are going. Hey, Kat, how are you? Thank you for coming back. And yeah, Kat, please, sister, keep working on the belief that this condition you have can heal. Don't fall into this idea that you're doomed for this the rest of your life. I know that the intensity of your mental illness will convince you that you're going to be like this forever. And the splitting off and the anxiety of not knowing when an altar is going to come out and how that affects you, and the medication and all of that, you got to keep working on it. Okay, Kat, don't give up. Okay, don't give up. If you need to access, different forms of meds or whatever, that's fine. I know it's hard not to, sister. I know it's hard not to, because I've worked with psychiatric patients who and schizophrenia and the degree to which that haunts them, and the pain that is pumping that out in them can literally make them feel like it's hopeless. I would just encourage you to keep doing the work. Okay. If you don't feel that that one counselor is enough, see if you can access someone else. I don't know if you've tried other forms of mental health treatment, but I know it's not easy, but you've got to keep working on it. Once you begin working more deeply on that pain, that trauma that caused the splitting, you'll see what I mean. You'll see what I mean, that it gets more and more manageable. I don't know how old you are, but it gets more and more manageable. And I know that's easy for me to say, because I don't have to worry about the things you have to worry about. When's the next split? I don't know what your family dynamics are. I don't know if you're able to work. I don't know if you're able to what your daily life is like. But all I would encourage you is keep logging on, sharing, what's going on in your world with us. And we'll give you the support we can. And so seriously, Kat, do not give up. Okay, don't give up. Keep going and trying to face a lot of what has caused you to split off. Take your cues from your psychologist. Keep working on it. Okay. So again, everybody, thank you for logging on. Thank you for the questions. I think I may be trimming down the nights to 2 nights a week only because, and I may be going on earlier, but I'll post things and let everyone know. But I'm going to be here. We're going to get through this. We're going to keep working on our mental health. We're going to keep being proud of the fact that we're working on our mental illness, whatever it may be. And there's nothing to be ashamed of. Okay. So again, have a great weekend. Thank you for logging on. If this is the first time you've logged on, thank you for your participation. If you're catching this after I upload it, please post it, upload. Yeah, I could just dated myself, but please make comments. Please ask me questions and keep the process going. All right. This conversation made me realize I am my third abuser. I'm going to work on that. Beautiful, Melissa. Beautiful. But remember, Melissa, you may be your third abuser, but you didn't ask for the first and the primary and the secondary abuse. Okay. So tonight, you're right. I am my third abuser. I don't need to be. It's okay that I am, but I have to work on that. I have to work on that because I deserve to heal. I deserve to stop victim bashing. I deserve to stop victim blaming. I deserve some peace. I didn't ask for the abuse, but I can work on it. Okay. So thanks guys for logging on. I appreciate all the support. Please share this. Please tell people about this. Please question the polarization we see in our society. Please, let's start moving towards this unpolarized environment in our world. If you're listening to podcasts and they have this extreme one narrow view of things, please question what's up with this dude, what's up with this woman what is going on with her, why am I listening to this person like they're God when they may have these issues and they're just vomiting them out and I'm ingesting them. All right, everybody, I'll see you next week. I'll post when I'm going to be on, probably I don't know, I got to figure it out, but I'll be on at least 2 times a week and might be a little earlier, but I'll let everyone know. Okay. Feel free to send me questions. Thanks again. Have a great weekend. Dr. Stephen Walker,